We'll move on to the comments to the board. At this point, we will open the floor for citizens' comments to the board on agenda items. Following board policy 006, what will happen, we'll open it up to the board. First, we'll do the online, some comments that have been presented to the board via our Survey Monkey, the link on our website. So we'll open it up. Dr. Fairchild will read those to the board. Anybody sitting here this evening in person, you will have 3 minutes to address the board. Just board policy, we are all ears tonight. This is something that we want to hear, get feedback from the community. It is for agenda items at this point in the meeting. If it's a non-agenda item, that will come at the end of the meeting. So if anybody filled out one online, Dr. Fairchild will read their name, their address, and we'll see the agenda item. Anybody in person, again, if you're addressing the board, we would ask you to let us know your name, your address, and the agenda item that you're addressing. So with that, Dr. Fairchild.
Sure thing. And yes, for those online, there's still time to make a comment. If you would like, you can visit our website at www.lasd.us and scroll down to the school board meeting item and then click on the Survey Monkey link. So our first comment this evening comes from Davina Laverty of 235 North 4th Street. In light of the PA State educational hearing that was held on Wednesday, August 4th, I'd like a discussion on the efficacy of masking children, since the evidence points to the fact that masks are ineffective, harmful, and unnecessary due to the lack of transmission and ill effects among children 0 to 20 years. It should be voluntary and left to the parent's discretion, as the parent knows what is best for their children and should not be coerced, pressured, nor shamed into compliance. Comment number 2 from Nick Persing, 134 North 10th Street. I've read in the newspaper and heard from other parents that there is a shortage of bus drivers all across districts in the Susquehanna Valley, including the Lewisburg Area School District. Since there is a shortage of bus drivers, how will students get transportation to their school that rely on the bus transportation system that don't have a driver for their bus route? Since there is a shortage of drivers to get students to school, this will obviously affect extracurricular activity in sports and their transportation needs. Will parents be notified about the bus transportation shortage if routes can't be fulfilled, so that they can properly plan instead of having their child or children standing outside then be late for school because there was no transportation? Comment number 3 from Alyssa Loud, 794 Warren Road. It's time to end the mask mandates. It shouldn't even still be a discussion. Our children are suffering for absolutely no reason. Mask wearing comes with its own risks and is completely unnecessary for a virus that has an over 99% recovery rate. And most likely, if they become infected, they won't even be sick. We're literally covering the 2 areas that supply our kids with oxygen for 1.5 years now. This is entirely political, and our children are being used as pawns. And allowing vaccinated children to come to school unmasked while unvaccinated children are required to wear one would be a huge mistake. Can you imagine the comments and bullying that would come from that? The vaccine is not approved. I think it's crazy parents would subject their kids to it, but to each their own. Parents who have wanted their kids to be vaccinated have done so. So it shouldn't matter who has a mask on and who doesn't at this point, because vaccines work. Masks should be 100% optional. We are failing our children. Side note, I know with complete certainty that our children know their teachers' political standpoints. It's become increasingly clear over the past year. A teacher or school administrator that makes their political opinions known has failed. This district really needs to hold these teachers to higher standards. I understand this has nothing to do with masking, but I do think it's been a more prominent issue since the pandemic. School should really be a place for some normalcy, especially after the awful year last year. It's time to get back to life as they knew it. Next comment. Lori Mildrew, 422 Beagle Club Road. I am in 100% favor of universal masking, regardless of vaccine status. Let us please put the health and safety of the kids and staff above political views. Kids do best in the classrooms. Let's keep them there. Next comment. Simone Roy, 204 South 14th Street. I urge the board to write a policy that conforms with the current CDC recommendations requiring masks of all students, faculty, and staff while indoors. Our children had enough stress last year, and this year should be focused on learning, not worrying about catching COVID while at school. If you could require vaccination, that would be best, but if you won't go that far, then I ask that the board to encourage vaccination and require masks. Next comment from Helen Nunn, 211 South 13th Street. Please follow the CDC and require masks of all faculty, staff, and students while indoors without regard to vaccination status. Next comment here. Come on, there we go. Mary Haig, 228 South 13th Street. I am writing to express my gratitude to the school board for all the extra and especially challenging work they have been doing in response to the pandemic. Please vote to approve the revised plan and continue working to protect all the students, staff, and visitors by following CDC guidelines requiring masks. Next one. Carolyn Coldren, 1402 Jefferson Avenue. Regarding the health and safety plan, specifically wearing of masks, with a rapid increase in cases and some concern that the COVID-19 Delta variant can be spread by vaccinated people, it seems a cautious, less time-consuming, and unifying approach to have all students wear masks indoors. It seems an unnecessary risk to wait and adjust the policy later once more students, faculty, and staff are infected and absent from school. Thank you for your consideration of this comment. Next comment from Craig Beal, 668 Equestrian Lane. I am in support of the current health and safety plan as approved, as well as the proposed revision to the health and safety plan. Masking is imperative for a successful and safe school year. Next comment. Eric Kennedy, 438 Pheasant Ridge Road. Dear board members, I am writing to lend my strongest possible support for the current revised school safety plan that would require masking for students pre-K to 8 at all times until at least vaccination eligible, and additional precautions if our community transmission reaches substantial or high levels. As a community, we were so thankful and proud of the in-person performance of our school district last year and the experiences that were provided to our students. I think my children's personal experiences were not dissimilar to what others experienced, that as our schools' in-person experiences were disrupted by periodic online formats, that their educational experiences suffered. I am personally in favor of evidence-based practices, and in addition to their documented effectiveness, the evidence suggests high personal acceptance of masking by a significant percentage of children, given thoughtful and mindful implementation of masking policies. Given the disruption that quarantine policies may have on our community if masking policies are not implemented, not to mention potential community spread, I support our continuation of thoughtful and mindful practices. I appreciate your time. Thank you for your efforts on behalf of our students, LASD staff, and our community. Next comment, Terrence Shea, 193 Mountain View Road. Good evening, and thank you for allowing me to share my comments tonight. I'm the father of 2 students in the school district going into 4th and 2nd grade. I would first like to say thank you to the school board, the administration, teachers, and all school staff for all of the hard work you did this past year to make in-school learning possible. Just a little over a year ago, my 2 children were so happy to step back inside Kelly, and they had a truly wonderful school year. Given the many challenges posed in safely reopening, I think it was an enormously successful 2020-2021 school year, particularly with having such a high percentage of school days held in person. Many children in the country were not able to go to school in person, or at least not until far into the school year, and so I will never take for granted what the Lewisburg Area School District was able to do for my children. My wife and I will be forever grateful for your work, and I think you all should be proud of your success. Thank you. I have read the current health and safety plan for the school year beginning next week. I think it addresses the current challenges that the pandemic still poses, namely the high transmissibility of the SARS-CoV-2 Delta variant, which has led to higher case counts compared to just 1 month ago. Among other benefits, I think the measures laid out in the health and safety plan will help to maximize the number of in-person days for all by minimizing the number of students and staff quarantines when their exposures to school-linked COVID-19 cases. I support this plan. Thank you to the administration for your work in preparing this sensible health and safety plan, and thank you in advance to the board members in voting to approve it. Next comment. Patsy Gardner, 815 Buffalo Road. We know in-school learning is fundamental to the development and well-being of our children. That is why I support continuing the same protocol to combat COVID-19 that LASD used during the 2021 school year, including wearing a mask for all students, teachers, and staff. There was little interruption at the LASD in comparison to other school districts. Numerous school districts who did not practice the same safe protocols as LASD had to go from in-person to online numerous times throughout the school year. This not only created a disruption in the education of the students, it uprooted the process used by the instructors, interfered with school sports, created chaos for parents who then had to take time off their jobs, which in turn created chaos for employers. After doing research on hundreds of school districts throughout the US, most are requiring that CDC guidelines be followed, wherein masks are required indoors. Therefore, I support wearing masks by all students, teachers, and staff at LASD to allow the students to continue in-school education and stop the spread of the virus in the school district as well as the community. In making this decision, we must also consider the healthcare workers. An outbreak in a school not only affects those in the school, but also affects the community, which could result in an overload in our local healthcare system. A hospital filled with COVID positive patients cannot provide care for patients injured in car accidents, heart attacks, etc. And that's it for responses now.
Okay. All right, then I'll move on to here in the room. If there's anybody who would like to address the board, we have the podium up here with a microphone as well. So if anybody would like to come forward, like I said, if you could please state the name, your address, and the agenda item. Sir.
My name is Joseph Riani. I live at 105 Bald Eagle Ridge in Lewisburg, and my daughter will be coming here as a ninth grader for the first year, I hope. I don't prefer masking. I think it interferes with a lot. I really believe in hygiene and hand, prior viruses, washing of hands, not touching of face and eyes was really promoted as the most effective way of preventing spread of virus. People don't feel that way anymore. I don't agree. However, I've asked my daughter if she minds wearing a mask, and she said if it means being able to go to school, she would wear a mask during the school year. The only thing I would request is that we don't have unvaccinated or vaccinated people not wearing a mask, and vaccinated or unvaccinated required to wear a mask, because that would open the door, because people are passionate, that would open the door for harassment and other bullying, etc. And I guess that's all my statement.
Good evening. My name is Matt Exley. I live at 194 Fairson Court. I'm a father of 3 students that are in the school district here, and I'm also the manager of environmental safety and security at the Evangelical Community Hospital, where I serve as the one of the incident commanders for the COVID response. So what I'd like to talk to you about tonight, just real briefly, that I've been asked to talk to you about. My intention here tonight is not to tell you how to vote one way or the other. I think most of you know how that should go. However, I wanted to provide you with some local information that might help you make your decision as you move forward. So in our hospital currently, as of today, as of 3 o'clock today, we are at 70% capacity. That's on a normal day. So 70% of our beds are full as of right now. Out of those, we have 12 ICU beds within our new ICU, and 10 of those ICU beds are full. So that means we have 2 open ICU beds. Currently, we have 7 COVID patients in the hospital. Last week, we had 0. So we've gone to 7 within about a week and a half time. Out of those 7 patients and out of those 10 ICU beds, 3 of those ICU beds are COVID patients, and 1 of those patients is on a ventilator. We are very concerned at the hospital in regards to a couple things. Last year, when we saw the COVID surge, we had between 66 and 70, depending on the day, COVID patients within the hospital. We're a 132 bed facility. 66 to 70 COVID patients within the facility was an extreme stressor on our hospital. With that being said, the one thing we didn't have to contend with last year was the flu. Because folks were in their homes, because folks were masked, we only had COVID patients to treat. In fact, we didn't get our first flu cases until pretty late in the spring this year because of the masking and the social distancing and whatnot. Our concern this year is if we do see a surge, such as Florida or Texas or those areas are having, we may not have the bed capacity to take care of the COVID patients that we did this past year. Because either those beds will be full of flu patients and we won't have enough beds to take care of COVID patients, or those beds will be taken up with COVID patients and we won't have enough beds to take care of flu patients. So it is a very big concern of ours as we move into the flu season and as we see this COVID surge coming back out. The other thing that we're concerned about, and this directly is affected with you, I know that the community affects that other piece of the puzzle quite a bit. But one of the things that really affects, in the last entry from the internet was kind of hit it spot on. You would not believe how much children being in school affect our ability to provide healthcare. And it's not just Lewisburg district, it's many districts that we cover. However, if kids are sick, if kids are quarantined, if kids are out of school, that means that nurse or that doctor or that tech or that environmental services person can't be at work helping us treat patients because they have to put their families first. And so they stay home with their families. And as you know, and if you don't, it's not new news, but many of the hospital facilities, not only in the region, but in the nation, are experiencing staffing shortages, and we are no different. So anytime that we do have those folks off, it's a pretty big impact on the facility. So I appreciate your time. I just wanted to provide you with some information locally that you can trust from your local facility so that you can make your decision tonight. Thank you.
Good evening. My name is John Delvecchio. I live at 3218 Stein Lane. I have 2 children in the LASD school district. I support masking in our schools, and that is what I come to speak to you this evening. American Academy of Pediatrics recommends masking in schools, especially in the under 12 age group. Just because there is a low incidence of severe COVID disease in children doesn't mean that 1, they don't get sick, that 2, they don't pass it on to vulnerable family members, and that 3, they don't further spread the virus and contribute to the incident of variants. Nobody wants a Lewisburg variant of COVID. Some say take the wait and see approach. By the time you wait and see, it will be too late to stop an outbreak. Our children's health is not political. Health is not political. It's science. It's true whether you like it or not. There's an error to be made. I ask that you err on the side of caution for our children's health. To do otherwise is to risk an unnecessary and possibly unmitigated disaster. Thank you.
Billy Allred, 5433 Stein Lane in Winfield. Keep it short. I have 30 reasons why I'm opposed to the mandatory masking for students. They're quick. Number 1, this goes beyond the CDC, the PA, Department of Health, and Governor Wolf's requirements. You're taking a tougher stand than any of them. You're differing from what the other 16 schools in the CSIU are doing. This is basically the only place where most students will be masking. They'll be free to go unmask everywhere else in their life until they come to school. So I think you'll have a different level of attention to mask than you did last year. Number 5, students who can't be vaccinated will be treated differently than those who won't be vaccinated. They don't have to wear a mask, so we're penalizing those who choose not to vax for personal reasons, but we're not penalizing those who choose not to vax for medical reasons. Number 6, more students will leave the district, financially impacting the budget. Number 7, school-age children are hospitalized at a rate of 1 in 200,000. This is not serious for school-age children. More school-age children died during the 2018-2019 flu season than in the 18 months of COVID. Number 9, teachers and parents have had the opportunity to be vaccinated. Number 10, there is still no conclusive medical studies that show that cloth masks work. Number 11, mask wearers, especially kids, touch their faces more often. Number 12, there are still no conclusive medical studies on the long-term psychological effects of masking. Number 13, masks centralize germs on the masks and then when touched on the hands and then on surfaces rather than being processed by the school's updated ventilation system. Number 14, the school has no substantive authority to mandate personal medical decisions beyond the authority of the state. And then several more from an editorial by Marty Markery of Johns Hopkins and Cody Meisner, who's an expert on pediatric infectious disease and the leading national expert on childhood vaccinations. He consulted with the CDC on the development of COVID vaccines for children. Those who have myopia can have difficulty seeing because of the mask fogging their glasses. Masks can cause severe acne and other skin problems. Number 17, the discomfort of a mask distracts some children from learning. Number 18, by increasing airway resistance during exhalation, masks can lead to increased levels of carbon dioxide in the blood. Number 19, masks can be vectors for pathogens if they become moist or are used for too long. Number 20, masks may exacerbate anxiety or breathing difficulties for some students. Number 21, covering a child's face mutes nonverbal forms of communication and can result in robotic and emotionless interactions, anxiety, and depression. Number 22, seeing people speak is a building block of phonetic development. It is especially important for children with disabilities such as hearing impairment. Number 23, the Delta variant is more contagious, but also far less deadly than other strains we have seen thus far. Number 24, you make no distinction between those who have natural immunity through infection. In other words, they're immunized because they recovered and they don't need a vaccine, and those who haven't developed antibodies. Number 25, we've reached a significantly higher level of herd immunity through infection and vaccination. Number 26, people of color are less likely to be vaccinated and therefore subject to unequal treatment. Number 27, there are no substantiated cases of student to teacher transmission. Number 28, it's child abuse to unnecessarily burden our kids with the responsibility to protect adults. Number 29, private schools are not masking. And number 30, this gives in and caves to liberal teachers unions. I'm against the forced masking of students, but if this board is unwilling to budge on the topic, I believe the following amendment, which I sent to you all via email, is a compromise that provides a way to mostly satisfy those who desire universal masking, but it also gives an exemption for those who strongly disagree and signal their understanding of the ramifications of their decision. My hope is that someone will move on this amendment when we come to the time of discussion of this budget item or this line item in the agenda, and allow for written waivers signed by parents that acknowledge these things. We still would have mostly mass school, but we would still give parents some choice. Thank you.
Anybody else?
Thank you for letting me come back and speak. Sorry if I'm a little nervous. I don't like talking in front of people, but thank you all for doing your job. And Jennifer, I don't know how to say your last name, but you just arrived here last year. I think you're doing a good job. Pretty much the previous guy just said all my reasons.
I'm sorry, we need your name and your
I'm
street
sorry, my
address,
name is
please.
Brad Strasser. I live at 111 South 12th Street over in Lintown.
Great, thank you.
I have a son. He's over there. He's going into 6th grade. And like I said, he gave a lot of reasons, good reasons why I think masking should not be in school unless you want to. I think it just comes down to personal responsibility. If you want to wear one, fine. If you don't want to wear one, that's okay too. I have not had anyone in my direct family directly had COVID or anything. My wife does work at EVAN. She's a respiratory therapist, and she has seen the bad. And she agrees with me about the masking for children. And I just implore you, just take this opportunity for the kids. Like I said, it just comes down to personal responsibility. Thank you.
Hi, my name is Dina Russell at 152 East Cardinal Street of Lewisburg. I'm not here to say yes or no. It's a personal preference of mine. as it is each and every one of you. I prefer not to mask. I feel, and I don't really need to give all my reasonings because there's several of them, as the gentleman before has mentioned. He kind of hit a lot of the topics I was going to say, so I'll save my time, or I'll save you guys time. Some of my questions that I have for the school board and what's going to happen is I heard things as far as schools being able to vaccinate children without parents' permission. I wanted to know if that's something that anybody else has heard, or if that's something the schools can actually do. I have a 11th grade student here in the school district, and I chose last year to pull her out of school because I didn't feel that her being masked really was affecting her or was necessary. As I've had people in my family, close family, that have had COVID. We, two of them being in the medical field. I'm in the medical field as well. And, you know, it affected them, but it affected in the same way that the flu affects people. So as I wanted to say is, if the flu, I mean, people get vaccinated for the flu, but the schools didn't mask up then. You know, if you can get vaccinated, I mean, you can get the flu shot or you don't have to get the flu shot, but people weren't masking for that reason. So I don't feel it's fair to our children to have to mask up to come to school because of the COVID. I don't feel that there's enough studies. I don't feel there's enough information, accurate information. So I just, you know, hope that you guys will do what is in best interest and give our students here at this Lewisburg School District the opportunity to make a choice, as they are going to have to make choices as they get out of school. They're going to have to make the right choices. They're going to have to make the wrong choices. So this is a way for them to be able to make a choice whether they would like to mask up or they don't, or give the parents the choice whether we feel that our child should mask up or not. Thank you.
Anybody else? John, have we had any other comments come in?
We'll see if we have any more here. Waiting for the internet. Okay, yes, we have one more comment here. Steve McEnany, 148 Dustin Drive in West Milton. I'm writing to express my support for the continuation of the implementation of the CDC guidance raising wearing masks in school for children who are not vaccinated. Please follow the science and disregard the popular sentiment that masking is not settled science. Thank you to the teachers and administration who are working to keep our children safe during these unprecedented times. One more check. That's it.
Last call, anyone else in the room? All right. Thank you everyone for coming here this evening, for everybody who submitted feedback. The board received quite a few emails that we read over, comments this evening, comments in person. So the board did definitely a lot of reading, a lot of thought on this topic. We'll come back to it here with our action, the board action section. So again, thank you for the community. Thank you for your involvement and coming to provide feedback to the board. With that, we'll move on to board representatives' comments.